Next is lifestyle. We've seen that many times, because of the fast moving life, career, and all the demands, there is so much of stress level involved. Your travel is so much, and there's so much of junk food intake, or it could be alcohol, smoking. All this can impact the sperm morphology or count motility. So we need to correct the lifestyle abnormality. Sometimes it could all be because of overweight, or sometimes it can also be because of too much of over exertion or exercise. You see, suddenly you joined gym and for 2 months you vigorously exercised and try to lose 10-15 kgs. That can also impact the semen analysis, though temporarily. So we need to be analyze this history, like whether your lifestyle was bad, your smoking, drinking, infection, all those things, and this would all say that okay, this could just be a temporary issue and it will pass off. So once we analyze this, we say okay, do some lifestyle correction. Now if there is no other history like that, we also need to do certain blood tests. We will be looking at your thyroid, prolactin and sugar values, liver function and renal function, because any of these parameters also can affect the semen count and motility. Now when the count is really low, then we also look for the male hormones like FSH, LH and testosterone levels. When the count is absolutely zero, then we also add few more investigations to find out the reason for zero count. I will deal about the zero count a bit later in my topics, because that itself is a separate entity. So we are only talking about oligoasthenoteratospermia. Another one thing which I would want to highlight here is the usage of laptop. I'm very kind of unhappy about this laptop being called as a laptop. So it generally means that you need to keep the laptop on the lap, right? So that's where we are frying our future generation. That's how I would like to put it, because if you put, as you see in that laptop, generally the backside or the surface heats up, and they do provide some kind of exhaust or a fan which blows out, but when you put it on the lap, laptop will heat up, and the nature is designed in such a way the testis is outside the body for a particular reason. It has to be in a lesser temperature than what the internal organs are or the body is. So outside or internal body temperature 37 degrees Celsius. So generally the testis is at 2 or 3 degrees Celsius less than what the body temperature is. Now you're putting a laptop on it and exposing it to such a high level of heat. Plus now we have added the internet, all the waves or whatever the radiation is all causing the damage to your next generation. Okay, not necessarily that the sperm count or motility everything has to be affected. We do not know the effect of this on the epigenetics or the genetics of the sperms, which can affect the the genetic component of your offspring. So my humble request is, please do not put that laptop on the lap, or I would probably I would request the companies to change the name of laptop to something else, because this is really killing the future. The next is using mobile and trying to keep the mobile most of the time in the pocket. That can also expose to the heat and radiation. We have also seen that some of the good mobiles can also get heated up, and we've also seen some reels where the mobile has caught fire. So please don't put your future onto the fire. So try to avoid these kind of gadgets as much as possible. Closeness, though we keep appealing this, I do see even in my clinic that patient will come and have to log in, and they'll keep the laptop on their lap and start working. So that is a very, very wrong thing to do. This can affect the semen analysis or count. So what do we do once we understand that all the reports are normal? When all the reports are normal and lifestyle is the only issue, then just correct the lifestyle. What in lifestyle basically is drink plenty of fluids, keep yourself well hydrated, avoid too much of heat exposure, in sense that traveling on bike for a very long distance, and particularly there are certain bikes which are with high performance bikes which are really heats their engine up, so those kind of bikes should be avoided. Long distance travel on a bike also should be avoided. Sitting for a very long time, desk jobs, if you're sitting on a very long time, then also there is so much of heat or congestion involved in the lower pelvic region, which can also affect the count and motility. So I generally advise that every half an hour probably you can just get up, shake your legs, move a little bit, and start working. I think every office should allow their the workers to get up and do this and not take it as very serious offense. Next is when we give this report, they think, okay, if we have more abstinence, the count may improve. No, that's a misconception. The more frequent, at least once in 2 days or 3 days, either a contact or ejaculation will prompt the testis to start producing more and more sperm. So that is like, you're asking the testis to come up with a new number of sperm. So the more the contact, the new generation of the sperms will happen. More contact doesn't mean that 2-3 times you do an masturbation or a sexual contact. No, that's not going to help. The ideal gap is at least 48 hours once, so that the regeneration of the sperms or spermatids do happen. We also put them on certain dietary advices, like drink lots of fluids. I've already told. Avoid processed food, because most of the processed food may contain certain kind of chemicals, or hormones may be used in poultry, which can again decrease your testosterone levels, or then it can mess up with your hormones. So avoid those kind of things. Eat organic, eat lots of green leafy vegetables. There are certain foods again which has to be avoided when you're trying to conceive, because certain food are anti-androgenic, so that needs to be avoided. We always put them on antioxidant. Antioxidants basically, as I said, oligoasthenoteratozoospermia could be because of increased oxidative stress. This could which has resulted from the lifestyle, or because of infection and fever. So by adding antioxidants, the oxidative stress is reduced. Does it work like magic? No, I'm sorry, it doesn't. So you have to give some time. So generally we say at least 4 to 6 weeks time is needed for any kind of an effect to come. After the semen analysis report which is abnormal, we ask the repeat semen analysis usually after 4 to 6 weeks, because it takes that much time for the semen to again correct its defects. Yes, after 2 reports, if the semen analysis still comes as abnormal, depending upon the parameters which is abnormal, we can further decide about the treatment. One thing which I want to stress about semen analysis to my viewers is, nowhere in this report it says that you cannot conceive with this kind of report. That you need to make put in your mind. Until unless it's a zero count, as I said, I will deal with this zero count later. If it is an oligoasthenoteratospermia, it doesn't mean that you cannot conceive. Countless, like 10 million, 5 million, nowhere it says you cannot conceive. If the motility is around 10, 15, 20%, it doesn't say you cannot conceive. These are parameters which we consider, or the WHO has told that this may require some kind of attention, but nowhere it is written that this is the value, then you cannot conceive. Because many times I see patients, very young patients, coming and saying this is the analysis, and I have been suggested straight away to go for IVF treatment, or even to a extreme extent I have seen that patients being advised to go for donor semen kind of a treatment. So please do keep this in your mind, that this is just the parameters for us to advise you about the treatment options and the ways to conceive, than to directly say that you cannot conceive or you need to directly go for any advanced fertility techniques.